I'm pleased to be joined today on Health Beat by Dr. David Keleny, a general surgeon with Faith Regional Physician Services General Surgery in Norfolk. Dr. Keleny, what is an appendix? What are signs of appendicitis, and when is surgery needed?
Well, the appendix, so that's one of the most common emergent reasons we will see a patient. So to start off, what is the appendix? So I have a picture right here. The appendix is a little finger-like, about as big as my pinky, projection that sits off the side of your right colon. So if you look at the larger picture here, that kind of sits in the right lower quadrant of your abdomen. Now, it's been kind of a matter of debate over the last several decades of what it does, and there's really no consensus to see what the actual function today is. Some people think it's something to do with the immune system. Some people think it's like a pool of good bacteria that lives in your gut, but there's no well-defined definition of what the appendix does.
I see.
Yes.
So is it age-related when the problems show up, or no?
Typically, it is not completely age-related, so we see appendicitis in very young people. We see it in very old people, too. And some of the most common symptoms of appendicitis will be abdominal pain. Specifically, as the appendix gets distended, it starts exerting a force that your body perceives as pain around your belly button, your umbilicus.
Oh.
And as it distends more, it starts to touch your abdominal wall, kind of from the inside, and then that localizes the pain down to your right lower quadrant. And that gives that classic pain presentation that people see, every once in a while growing up on TV and things like that.
Sure. Oftentimes people want to know if it's diet-related.
No, not diet-related. Yeah, they have not, or scientists haven't elucidated any specific relation to a diet as well.
So no problems with spicy food or eat what you like, right?
Exactly.
Okay.
Yeah. So if you have some of these symptoms and the abdominal pain moves from the belly button down to the right side and it's just not going away, you feel nauseated, you're just not feeling yourself, then you definitely have to seek medical attention at that point.
I see.
Yeah. And the management for the appendix is we would remove it surgically with a minimally invasive method.
Okay.
Yeah.
Very good. Well, thanks for being here today and sharing that with us.
Absolutely. Thank you for having me.
You bet. And that's Health Beat, brought to you today by Faith Regional Physician Services.